I'd like to concur and respond to my friend from Louisiana. We are just kicking the can down the road, but we have been doing that under his party's leadership for the past 8 years or so. And the truth is that none of us, the distinguished ranking member of the Health Subcommittee, the distinguished chair of the Health Subcommittee, have any idea how we're going to solve this physician reimbursement for the long run. And we don't have time. But I think we've all agreed on a bipartisan basis that it is an issue that we have to address as quickly as possible. So we do recognize that this is a temporary fix, and we do recognize the serious problem of reimbursing physicians, but I don't think there's any chance that we could get that done in the time left to us in this session. And some of the things that we have added, not all of the things we passed in the CHAMP Act, but there's mental health parity for seniors, which means that they no longer have to pay a 50% copay for mental health, but a 20% copay as they would for other services. There's preventative care opportunities for Medicare beneficiaries. There's support for low-income beneficiaries. There's work toward resolving medical disparities, an issue which is of concern to many people in this country. There is electronic prescribing, e-prescribing as it's called, which we think will be safer and more cost-effective in the distribution of pharmaceuticals. As for the durable medical equipment bidding, I want to correct the statement made earlier. It isn't going to cost the taxpayers anything. The CBO has told us that the way this bill is designed, the durable medical equipment providers will pay for this at their option to take an across-the-board cut in their reimbursement rather than have a bidding system which they felt was unworkable and not realistic. I yield myself an additional 30 seconds.
Without objection.
So while I think that it's not everything that we wanted and that we voted for in this House on a somewhat less strong bipartisan basis a year ago, we've made some bipartisan steps down the road. We got bipartisan support in the Senate. And what I hope, recognizing that many of us would do each of these things somewhat differently, a vast majority of us here and in the other body have come together as I've not seen in the past 10 or 12 years to work out a bipartisan agreement to proceed, and I hope that is a harbinger of the future, and I reserve the balance of my time. Madam Speaker, I yield myself the balance of my time and urge a vote to override the veto. It isn't everything everybody wants, but it protects 40 million seniors from losing their access to primary care physicians, and it gives us time to deal with the reforms that are necessary in an orderly way. We should put an end to the overpayments to Medicare Advantage, stop giving them a blank check to provide services which in many cases are second-rate. The good managed care plans that are not-for-profit and come under the Medicare Advantage plan can exist at 98% of payment. There's no reason to overpay the charlatans who provide second-rate service and overbill the taxpayers by anywhere from 13 to 40%. We've made some advantages, added some benefits, come together on a bipartisan basis to give us time to do the work that we should to make our Medicare system sustainable, expand its benefits, save money for the taxpayers, and provide the kind of quality medical care to which our seniors are entitled. I yield back the balance of my time urging a yes vote to override the veto.
The gentleman yields back the balance of his time.